Hi everyone, thank you guys for listening to my presentation. I'm Rachel and I'm a personal trainer out in Malvern, PA. The company I work for, Fitness Trainers Incorporated, provides fitness programs for individuals who have had a life-altering injury or illness. This graduate program has taught me useful information that I have been able to use for most of my clients, and it also has provided me with modifications or adaptations that I can use in a fitness setting. For my presentation, the topic I chose is accommodating students with behavioral challenges. But before we begin, I hope everyone was able to print out the critical thinking activity and was able to answer, if not some, but all of the questions. I'll ask you guys to please have your paper next to you because I'll be addressing these questions throughout the presentation. So let's go ahead and get started. To begin, let's address how do you define emotional and behavioral disorders? Emotional behavioral disorders, also known as EBD, are disabilities that are characterized by the inability to build or maintain interpersonal relationships, lack of ability to learn, consistent or chronic inappropriate behavior under normal circumstances, and the tendency to develop physical symptoms. These could include pains or even fear associated with personal or school problems. Now, these four characteristics are not the only characteristics that define emotional and behavioral disorders. At the end of this presentation, I've attached useful links that can summarize a little bit more and give you a little bit more information on exactly how to define what an emotional or behavioral disorder is. A student with EBD may display one or more of the previously listed characteristics. Usually these would exist in excessive duration, frequency, or intensity that interrupts with education and performance. A child would need documentations of comprehensive prior assistance. These could include counseling, modifications, database progress monitoring, psychological and educational evaluations, observations of different behavioral patterns over time, and evaluation of current characteristics. This would all need to be done before being placed in a specific program for children with EBD. So now we're going to look at emotional behavior disorders and education. Students with EBD are of average intelligence, yet they face issues with learning skills because of external and internal behavioral adjustments. These could include acting out, poor social skills and development, anxiety, and depression. So students with EBD are most likely in an inclusive classroom setting since they compile more than 80% of all students with disabilities in the U.S. Students with EBD exhibit poorer attendance rates, higher dropout rates, and higher rates of grade retention. So when it comes to education, students with EBD have many learning needs. Now I want you to take a look at what are the two educational learning concepts that students with EBD may struggle with. Now there's more than two, so I'm sure whatever you listed on your sheet is probably accurate, but the ones where I'm going to list might be a little bit different. So they often have difficulty learning skills such as math, reading, and writing. Students with EBD may lack the focus needed to concentrate on a specific task. So these could include memorizing information, creating independent learning skills, and they may even lack fine and gross motor skill development. Therefore, this creates a difficult time for students with EBD to succeed with handwriting, spelling, spatial organization, forming numbers, and understanding mathematical language. So now we'll look at learning skills. Students with EBD struggle with skills that could help them learn more readily. So what are some skills that students with EBD may have difficulty performing? This is pretty similar to the question I asked previously, but it would still include things such as memory, reasoning. They may have a shorter attention span and have more trouble concentrating, and they would also lack academic survival skills. So now we'll look at classroom conduct. So students with EBD may engage in aggressive and disruptive behaviors. So thinking about your own personal experience or what you've learned so far, what are some behaviors that a student may display that can be categorized as disruptive? So these are just some examples, but not limited to. Disruptive behavior could be hitting, teasing, hyperactivity, yelling, refusing to comply, crying, and vandalism. But a disruptive behavior can be anything that disrupts the classroom setting and strays the other students from learning as well. So taking a look at students and social relations. So students with behavioral disorders may have trouble in social relationships among peers. So in your own experience, could you think of one reason why students may have difficulty engaging in social behaviors among their peers? There's a number of different reasons, but we'll take a look at that students struggle with engaging in socially appropriate behavior. Therefore, they may have difficulty making friends, carrying on conversations, or even dealing with conflict. One of the main reasons students struggle with interpersonal relationship issues is due to the fact that they have trouble reading social cues. So if they have trouble reading the social cues, they would also lead to misinterpreting the feeling of others, and therefore creating an awkward situation that could make them feel uncomfortable and inhibit of them trying again. Therefore, students with EBD often face challenges with self-image, anxiety, and depression. So as you can tell, emotional and behavior disorders can build up and cause other issues as well. So now that you have a little more background information on emotional and behavioral disorders, we're now going to go ahead and go to the topic that I chose again, which is accommodations for students with BD. And as you can see, the picture below shows a teacher in a small group setting. So for starters, behavioral accommodations are specific interventions that can be implemented to support the student in a school setting. Accommodations can be environmental, academic, and sensory. These accommodations, should be specific for the student. Therefore, one type of intervention and accommodation won't work for every student with a behavioral disorder. So let's take a look at environmental school setting. So what are some techniques that you use or that you could think would be beneficial to create an inclusive setting? And of course, it came up with the answer already, but I hope you guys had something written down on your questionnaire. But these are just some of the topics that you can use in your classroom. So one of the things is to minimize visual and auditory distractions. This could be by not having a lot of posters or using headphones when you have students working on projects that may include video or sound. Research shows that it also helps to seat the students with EBD near positive role models. Also to monitor the access to small objects, because these could be seen as distractions. You could also provide students with a designated cool-off area, and also provide students with a place to work independently. Research shows that the include strategy is also a good technique to use in a classroom setting. So therefore, the include strategy starts off with identifying the classroom demands, which means trying to identify what each student, especially those with BD, need to succeed in class. You would also note student learning strengths and needs. You would check for each potential area of the student's success. Also, you would want to look for potential problem areas. Use that information to brainstorm different ways to differentiate instruction. Using that information, you would then differentiate instruction based on the student's needs. And from there, you would also evaluate the student progress. Like I said before, not every student is going to be the same, so the include strategy will need to be specific for each student. Now looking at the classroom routine, here are some tips to add to the classroom that might help students with BD succeed. So one of the things they start out with is saying, post and review daily rules and expectations. Create consistent routines. Provide the student with activities to keep them engaged throughout the day. Provide opportunities to practice emerging social skills. Also use a timer or clock to help with time limitations. You could provide peaceful activities to help calm down a student if an aggressive situation occurs. This could be part of that cool down or cool off area that we talked about in the previous slide. And also a big tip is to notify the student or students of any schedule changes in advance if notified. That way they are prepared for something that may be off schedule. So in doing some research, I came across this question and wanted to throw it out to you guys to see how you feel or what your experience is. So as educators, do you feel that a zero tolerance policy would be effective for students with EBD? So from what I've gathered, that researchers actually agree that these policies that automatically suspend or expel students for certain infractions is more harmful to students with EBD. You could be lowering their self-image and also be affecting their anxiety and depression because school is already maybe a personal struggle for them already, so having the zero tolerance policy could deter them completely. With that being said, what are some intervention styles that present best practice for students with EBD? Is there any that you guys use currently in schools or that you find specifically helpful? So what are some intervention strategies? Looking at the first one is called a tiered program. These have been an effective intervention strategy, and they show positive behavioral support, which shows strong potential for student populations. So looking at this chart below, the vision is to provide effective intervention to meet the needs of all students. And this could be through early and scientifically based interventions through careful system planning. So looking at the behavioral system on the right here, the first tier, tier 1, is the core instructional intervention. And this is in all settings and includes all students. It's trying to be preventative but proactive. Tier 2 is the strategic group intervention, so now you're narrowing it down to a more included population. So this is only some students that are at risk for BD, high efficiency, and a rapid response. And lastly, tier 3 is the intensive individual intervention. So this focuses on the individual student through group or individual plans. You could also use your IEP in this as well. It would be assessment-based, and it is an intense, durable procedure. The next intervention strategy we can look at is the peer assistant class-wide tutoring. This is a widely recognized model, and it involves assigning students into pairs to peer tutor one another in a structured format. So therefore the students would be following a format that the teacher would provide to keep them on track and answering the right questions and helping one another. The last intervention is called the self-management intervention. So this is where the students themselves would monitor, manage, record, and assess their own behavior and academic achievements. And this can be implemented at various grade levels. So to break down the self-management intervention, you would start out with self-monitoring, which is when students both observe and record their targeted behaviors. You would then look at the self-evaluation, where a student compares his or her performance to established criteria. The third would be self-instruction, which would be student-directed behavior is guided through the use of self-statements. Goal setting, students select a goal and create personal guidelines for commitment and progress toward that goal. And lastly, it would be strategy instruction, and this is where students are taught steps that will be followed independently with the overall purpose of solving a problem or reaching a specific goal. So next we'll look at addressing the social and emotional needs. So many students with learning and behavioral problems will not acquire important social skills. Therefore, adaptations will depend on the specific type of interpersonal issues that the specific student faces. There's different types of training to help students engage in the appropriate social behavior. So 3 types of training are your social skills training, your self-control training, and your attribution training. Each of these training would be dependent on the student and what interpersonal issue they face personally. So what are some ways as educators that we can help enhance a student's self-image? So using the attribution training, this convinces students that failure is due to lack of effort rather than their ability. This concept encourages students to be persistent and improve performance when faced with difficult tasks. So some ways we can put attribution training into our classrooms is to set reasonable goals for each student, provide specific student feedback, give student responsibility, and also allow the time and give students a time to show their strengths. So as educators, from your personal experience or what you've learned so far in the presentation, can you come up with or do you currently use modifications in your class setting to help a child with EBD find success? So looking back, some of the behavioral accommodations we can make can assist students with beginning steps to complete assignments, using peer group evaluations, using the self-management assessment tools, using the tier program, and providing student-specific feedback. Something we didn't touch base too much about, but we did discuss were the sensory accommodations. So some teachers actually report using seat cushions as to bring up comfort level for students with BD. Providing fidget or weight items. Just make sure that these items are not accessible throughout the entire day because they would be seen as a distraction. This should be just to give the child with BD something to focus on for a short period of time before putting them back on a certain task. Lower lighting has also been seen to help students with BD. Make sure that you provide age-appropriate toys and games. Provide an exercise program. And create visually pleasing environments with limited distractions. And again, this could also be with the low lighting, and as talked about before, using headphones when doing video or audio, and also having less distractions around the classroom. So as I stated before, here are some helpful links that I used for this presentation. The first one, it provides short and direct accommodations and actually is a really great summary for modifications that can be used in the classroom setting in order to achieve different student goals. I'm actually going to list a couple before so you can see if this would be helpful for your classroom. So it states that the following is a list of needs and modifications to help a child with an emotional behavior disorder. So one of the needs, they could have a difficulty establishing a variety of relationships. Therefore, you could set up goals aimed at social interactions. You could also use role-playing situations and use seating arrangements to encourage social interaction. Also, children with an emotional behavior disorder can have skewed views of long-term possibilities, and this could be connected to their low self-image, anxiety, and depression. So therefore, you could actually include the students with EBD in their own IEP process so they can feel as if they have a voice in their own goals. And for also help them take notes on their goals in order to succeed. Children with EBD are often faced having struggle academically in reading, writing, and arithmetic. Therefore, you have to set up personalized goals so that the child can find success. And then, like all disabilities, early detection and intervention is the very best strategy. Children with emotional behavioral disorder, they also may appear easily distracted, like we've discussed before, less attentive, and have very poor concentration. Therefore, the teacher or educators should set clear rules and expectations, and we discussed earlier where you should talk about the specific rules and goals of the day before every class period, and also set up an environment and materials that are stimulating but also age appropriate. Children with EBD also may be dishonest, blame others, and bully others because their self-image is very low. Therefore, you should clearly post all classroom rules, stay consistent with your expectations, and set boundaries between other students. You could also develop a keyword for the specific student to note whether their behavior is being inappropriate or not, and you can make that between the teacher and student so that other students may not know exactly what you're referring to, so that you're not going to embarrass the student with EBD in front of their peers. Students with EBD can be truant from school and disruptive. One of the modifications would be just to communicate with the parents and to match strategies and expectations used at home to the ones used in the school setting. And lastly, kids with emotional behavior disorder often have low self-esteem, high stress, and like we talked about before, a low self-image. So the modifications used can be to use that cool-off area as a place for them to escape and relax and calm themselves down. Put self-monitoring and self-control techniques into place. And be aware of your personal speech as an educator and verbal cues when talking to the student. Next is a link that provides information on the tier programs and how to implement it in your classroom setting. And lastly, the last link on the bottom is tips for creating an inclusive and successful classroom setting. And this is from a teacher in Colorado that has had, I believe she had about 20 years of experience working with children with EBD in her classroom. And so she was putting together a list of the best techniques she came up with and that she could use in the setting. So lastly, here's a list of all the references. Feel free to click on the links or check out any of these for more information. So I wanted to thank you guys for listening to my presentation. I hope you were able to take away some useful information and also fill out the critical thinking activity. If you have any comments or questions about the critical thinking activity, feel free to send me an email and I'll do my best to respond. And also thanks again, and I look forward to answering your questions.